it's me again, and today I have a special guest. So my guest is Shweta Ramkumar. She's a communication coach for ESL healthcare professionals, and she helps them build better relationships with patients, consistently delivering positive experiences and achieving professional excellence. Shweta, thank you so much for accepting my invitation. Could you please introduce yourself? What we know what you do, but could you just rephrase it in your own words? What do you
Sure.
do? What's your mission and why?
Hi, Anya. Thank you very much for having me on your podcast. It's a real privilege and honor. And thank you for the introduction as well. So, my name is Shweta. I have been coaching healthcare professionals from non English speaking backgrounds, not only in English fluency, but also in their communication skills, with the ultimate aim of making them better communicators with that who can communicate with more empathy and impact and influence, as well as connect better with their patients and achieve professional excellence and progress in their career and leave their patients coming back for more. So, in a nutshell, that's what I do. How I got started in this process was I always had a keen interest in healthcare as a child, to the influence of my mother, who's a doctor. And but I was very clear that I did not actually want to be a doctor just like her. I liked talking about healthcare, and I in particular liked teaching about it. And on top of that, also the human body and biology aspect of it was a keen interest of mine. And because I have always been a teacher in my life, I felt that is there a way in which we can combine these two strengths and passions of mine together? At the same time, I felt that whenever, as a patient myself, whenever I sought healthcare facilities, sort of saw a lot of the pain points and challenges that patients faced when they were in discussions with their healthcare provider. And so it was always there at the back of my mind that we can do something to fill this gap in some way. So that's where my coaching practice sort of came into fruition, where I felt that there was a need for this, in particular, now that the landscape of healthcare is really changing now. It was not how it was 20, 30 years ago. There's a lot more diversity. There's a lot more the expectations of patients have changed as well. And also, technology plays a huge part now in how we connect with our patients, which was not the case many years ago. So I'm taking all that into consideration and using that as the foundation of the coaching that I do.
So you have mentioned neurodivergence, and I have to ask, what made you connect neurodivergence with communication in healthcare? Because it is important, and we need more people like you, connecting those dots. So what made you connect them?
So what I did mention was diversity, but interestingly, I what got me connecting the two elements was two things. I have a lot of friends who are neurodivergent. That's one thing, and the other thing was on Netflix. There's a show called Love on the Spectrum. I'm a big fan of that show, and I watched all the seasons of it till date. And over on that show, obviously does emphasize on neurodivergent people. And I'm sure that there is going to be, I'm sure these people are also going to need healthcare at some point. So I felt, and given that I talk a lot about cultural diversity in patients, and yes, that's also visible. Neurodivergence is getting a lot of recognition and visibility now, which was not the case many years ago. So if when someone was very, you know, less normal and quirky and eccentric in many ways, we just put that label on them. Now there's a reason behind it because we have a lot more awareness of what they might be, and there's a way of testing what it might be. So obviously, when a neurodivergent person will operate and sort of learn things as well as absorb and interpret information in a very different manner to a neurotypical person. So it's important for healthcare providers to again be aware of how exactly they can work well with neurodivergent people. I think, and a part of me also feels a little bit. I feel a little bit of empathy towards them because I think that we sort of, unfortunately, a lot of it is labeled as a disability, which is not really the case because neurodivergent people are more than capable, or even I'd say more capable than neurotypical people of doing a lot of things. But their opportunities are really severely limited because of just who they are, which I think is really, really unfair. So it is important that healthcare providers are aware of, not just the ones who are treating neurodivergent patients firsthand, so like speech therapists and any sort of therapist, but also even your regular GP or a surgeon, or say even an OBGYN. So these people all will need to be aware of how to say something so that they can clearly understand it without any sort of misinterpretation or any misunderstanding, because a lot of neurodivergent people do take things as face value. So when you're trying to say something lighthearted, they might sort of take it quite literally as just the way it is. That's just one example, as well as the environment in which you treat neurodivergent patients or support them. That has to be also aligned in a certain way. The pace with which you deliver information to them, the type of questions that you ask them, all of this is important. That healthcare providers do need to be well versed with all this in order for them to provide these patients the best care and support that they need and deserve.
Absolutely. And I have mentioned so many important points. And again, the question comes to my mind, how do you think neurodivergence will impact healthcare communication? Because it's been impacting healthcare communication. There are so many changes. You've mentioned quirkiness and labeling. Hopefully, we will see the time when it ends. But how do you think it will impact healthcare? Because whether we like it or not, all of us will be patients at some point in our lives, right? Knowing that
Yes.
a huge chunk of people are neurodivergent. So what about that impact on healthcare communication? How neurodivergence will impact healthcare communication, in your opinion?
So it would actually challenge healthcare providers to take their communication skills to the next level. And all of the training that they have, received by myself or any other coach will have to be now in some ways molded in a way that can really be interpreted accurately by the neurodivergent patient so that there is no room for confusion or misunderstanding. So for example, the way in which that you build a good relationship with them. Now, again, I can leave a note of a framework that I have that I use in one of. I've done a couple of videos on my YouTube channel on this one, which again I can leave you the links of that one. But one of the frameworks in which that you communicate with neurodivergent patients is there's a framework called Step It Up. So essentially, it means that it tells you exactly about 7 to 8 guidelines about how you actually should communicate well with a neurodivergent patient. So, for example, keeping questions quite simple and direct, and keeping information quite brief. And the other thing, obviously, is give them the time to you know uh, craft a response, and you might need to give them extra time, more than what you would with a neurotypical patient. And also explaining information to them, you have to do that in a very step by step, methodical, quite rigid sort of manner, which you may think that it's a pain in the ass, but it's actually the way in which a lot of neurodivergent patients will understand it. Now, mind you, the other thing is that neurodivergence is a spectrum. It's not just like every neurodivergent person looks and operates the exact same way. So it's important that healthcare providers are trained to not only know the basics of all the different conditions, but also identify them in patients, not just for the ones who are working with these patients one-on-one, like your therapists, but also other healthcare providers. So familiarize yourself and educate yourself with that, and keeping the language quite precise and factual and to the point, by avoiding any metaphors and euphemisms, because again, they do tend to take a lot of things just as face value, and literally, and also saying exactly what you mean, and mean what you say, and be very, very descriptive. Now, that's something that I'm good at. I don't know, sometimes I've questioned whether I'm neurodivergent in the first place in some respect. Not that if I do have that condition, I'm not going to see it as a liability. I'm going to use it to my advantage, if anything. And it's also important that healthcare providers include uh, the people who actually advocate for a neurodivergent patients. So, for example, their carers, their support workers, and everybody, because they are the ones who are going to advocate for the patient when they're not important that they take it on their side. And also for them, if there is an equipment that a provider is using, for example, a healthcare provider on a patient. So I'm just giving a simple example of, say, a stethoscope, or say, like a device or a machine. Get them to uh, touch it and feel it first, and also warn them about what they might experience in terms of the sensations, because they can be a lot of neurodivergent people can be quite highly sensitive. And also the environment in which that you give the consultations to them, keep that quite, not only silent and quiet, but also having just how you physically set it up. Now, it's a little bit harder when you do this in a remote environment, but it's important to, again, when you speak to them, to have your tone of voice has to be a little bit more gentle, more on the soft side. And also all the other things that I have mentioned, that has to be quite these are just some of the tips that you can sort of incorporate in order for neurodivergent patients to feel comfortable and happy in that environment. Yeah.
So these are very important points, and we've been talking about communication. And I wanted to ask, in your opinion, and from your professional experience, is neurodivergence over or underdiagnosed and represented in the healthcare industry?
Now, I personally am not someone who has ever worked with neurodivergent in that sense, where I do the diagnosis and all that. So it's not something that I'm able to comment on. I just feel that nowadays a lot of my own friends who have been diagnosed with things like autism and ADHD much later in life, when they were in their 40s and 50s. So in some ways they're like, and back in my day when I was teaching in high school, my interpretation of what an ADHD person or student was versus how an ADHD adult is completely different. So the things that they are able to do very well and not able to do so well. So in many ways now, whilst it's a good thing that there is a diagnosis for that explains why people are the way they are, sometimes I also unfortunately believe that when a person is not conducting themselves appropriately, it the neurodivergence labels sort of almost becomes like a scapegoat, and you sort of are allowed to not hold it sort of lets them get away with murder, in very simple terms, and they are not held accountable to the same standards as neurotypical people. So that's the only one disappointing thing. I feel like in the healthcare industry, there needs to be a lot more awareness and understanding amongst healthcare providers who are not just working in the therapy space. So people who do other types of other types of treatment and other types of medicine fields of healthcare that they are working in. So I think they need to, as I said previously, they need to educate themselves about what neurodivergence is. And workplaces also need to provide this type of training, because as teachers we get it all the time. When we have neurodivergent students, how we teach them and everything like that. I think an equal, if not the same amount of training should be provided to healthcare providers as well, so that they are well versed with tomorrow, if they are given the information about a patient of theirs who might be on the spectrum, how they can sort of alter their communication so that they are understood and they build that connection, and they are able to offer the care and support that's required for them. So I think a lot more education, training, and awareness needs to be towards all healthcare professionals, for them to understand how they can best connect with and relate to neurodivergent patients. And while on the other side, the other thing also is that a lot of healthcare providers themselves might be neurodivergent, and I do mention this in one of my videos, that where like they if they are feeling like they're not getting the necessary results and feedback from their patients, they might need to stop and question, okay, I might be on the spectrum, what can I do about it? How can I change my I can change my approach when I'm communicating with my patients. How can I alter my work environment so that I can be of the best version of myself to my patients? So what I'm saying is you're sort of looking at it from both sides. So yeah.
Absolutely. And I know you're a communication coach. And can you please elaborate what led you to the idea of the coaching brand? Because it's really very, very interesting.
So, like I mentioned previously, my mom is a doctor because we used to have, back in India where I grew up, patients used to come to our place. Not regular patients, but the people who just could not afford it. So people who were like pretty much living in poverty, and she would sort of give medicines to them and give them. And I could always see that she had a knack with these people in particular, and I felt that she was very almost like she was a magician with these people, and I felt that how she communicated with and related to these people was very one of a kind. And obviously my interest in healthcare myself, and my background in teaching, and I sort of was looking for a way in which not only that I can build both these skills together, like combine them, and also see what the world really needs, because I'm someone who has traveled to many countries and lived in many countries as well. So in that sense, I felt that nowadays the diaspora really of healthcare in general is very different to how it was 30-40 years ago. There's a lot of non-homogeneity, so we have patients of all ethnicities, cultural backgrounds, and not just amongst patients but also healthcare providers who are all very culturally, linguistically, religiously diverse. And also another aspect in which I'd like to introduce diversity is that in sexuality, so, and also gender. So again, that was not the case many 30-40 years ago. So keeping in mind that there's and also the fact that technology plays a huge part now in how we facilitate not just communication but the other parts of healthcare as well. So I sort of touch on all these elements in my coaching. So I felt training healthcare providers to communicate in all these different ways, for them to really be more human, genuine, and empathetic. When they may have this looming threat on everyone's head, is that AI is going to take over my job. Uh, but the reality is that there are some things that a machine cannot, like the machines just cannot do, which is be more human and build that human connection. And I think when you say step into communication in this day and age, that's really what you are sort of not only sort of changing people's mindset on what AI can and can't do, but also make them into encourage them to come into their own, speak from their heart, and uh, an actual human behind the one who's talking, doing the communication. So these are the different things in which I said, yeah, this is a good sort of path to sort of coach, way to sort of coach people who really need.
And I know that you have a coaching program. Could you please talk about the structure and the benefits of your coaching program? Of course, I'll put a link to a discovery call and Shweta's socials, but could you just briefly introduce the benefits and the structure? Because I think that the program is really amazing and I would love you to share it with the world.
So the program itself it's got about 7 modules, and it starts off with self-awareness. So it's not a typical way in which you would start a coaching program, but I felt that self-awareness is everything. I mean, if you don't know who you are and why you are, changing something about yourself, or modifying, or being coached about something would be a much more challenging experience. So the first module talks gets to clients to reflect deep on what is it that has made them who they are, not just in terms of communication, but in terms of what made them choose their career in healthcare. That's the first thing. And also, I talk about the core skills that all healthcare providers need to how to become better in those areas. So things like active listening and empathy. And I also debunk things like what professionalism is. So back in the day, professionalism meant something completely different, whereas what it is right now, and how you can still be human, genuine, empathetic, and still be professional is something that I do touch on. I also touch on again what I mentioned previously, the cultural and linguistic diversity, and how and what strategies healthcare providers can incorporate in order for to take into account this changing diaspora and the diversity, and how they can communicate with them. And also a huge one that a lot of programs don't really talk about is patient autonomy and advocacy. So a lot of patients you would say that they're not feeling heard or understood by their healthcare provider. So how, as healthcare providers, we need to be their cheerleaders, and we need to be the ones who sort of have to sort of be their backup and be the person who would really stand up for them instead of doing things like gaslighting them and judging them and dismissing them, which is what healthcare providers have typically done. How undertaking this different approach is what will really build the trust and autonomy. And also in the end, now this, a lot of other teachers and coaches do talk about this, but I do briefly mention about, how these skills can help you not only land, the career of your dreams, but also equip you with the skills of how to live and work in countries outside of where they're born. So it's got a little bit of that element as well. So it might feel like all of these are sort of not related in some way, but if you look at it holistically, all of them, they come together and sort of train the healthcare provider to I think transform into a different individual while still maintaining their professional ethics. So in a nutshell, that's what the coaching program is essentially about.
Thank you so much. I really appreciate it. All the links to the coaching program, YouTube, TikTok, LinkedIn will be hyperlinked in the episode show notes. So thank you so much. I think I have learned a lot because it dawned on me that I really didn't think a lot about neurodiversity and the healthcare, and it's such an important subject. So thank you so much for being my guest and accepting my invitation.
Thank you so much for having me, Anya. It was a real privilege and great work on the podcast that you do as well. So, yeah, keep it up.
Thank you so much. Thank you so much.